Ladies and gentlemen, we've been hearing a lot of chest thumping lately about some of the policies going on, some of the changes in our Commonwealth. And, you know, my family, well, half my family is from the southwestern Virginia. I have some sympathy for what's going on down there with the economy, what's going on, especially in Roanoke. The Norfolk and Western Railroad employed a good number of my cousins, my aunts, my uncles. But I think it's also important to recognize, folks, we're all in this together. The economic distress that's been felt around this state affects everybody. I was just at a town hall meeting this past weekend where I heard some briefings from some of our local officials in Fairfax County. In the last 2 years in Fairfax County has lost 8,200 business and professional services jobs in addition to 4,700 government jobs. That's 13,000 jobs lost in Fairfax County. The economic distress in this state is not only felt in the rural regions of this state. Just so you have an idea of what that means, most economists say that one business and professional job equates to about 3.5 retail-level jobs. So these are big jobs that have big economic impacts. They have big revenue consequences for the state, and they're affecting everybody, not just those of us in Fairfax, but they're affecting everyone. And everything that happens everywhere affects all of us, whether we like it or not. October in Fairfax County was the 8th consecutive month of year-over-year home sale declines. Fairfax County has 19 million empty square feet of office space. 19 million empty square feet. That's more square footage than Loudoun County has to rent. And that's all in one place. The economic distress is bad around this entire state. Let me give you another statistic. Fairfax County has over 50,000 children in its public school system that receive free reduced lunch meals. Okay, there are 146 school systems in the state. There are only 4 systems. There are only 4 systems that have more children than Fairfax County has free reduced lunch meal students. Poverty is a problem, not just in certain parts of the state. It's a problem everywhere, and it's a big problem everywhere. The reason I bring this up, folks, is that we're all in this together. When one region hurts, it all hurts. When one region needs help, we all have to help. Our caucus believes that the solution to this is we need to raise wages, we need to invest in education, we need to invest in people's health care, we need to invest in people, and that's how we solve these problems. And we need to be able to talk about this without pitting one region of the state against the other. Now, I want to focus really quick, Mr. Speaker, on health care because the minority leader and I sent out a letter to everybody last week. Before I get to that, I also want to note that there's a lot of misinformation out there. I just saw this weekend that our former colleague, Congressman Comstock, got fact-checked and was pointed out that she was mostly false when she was trying to blame President Obama for escalating health care premiums. When PolitiFact actually looked at her statement that health care premiums had gone up a lot under President Obama, PolitiFact pointed out that other studies had shown that the rate of increase in health care premiums under President Obama has been 50% less than President Bush. Imagine that. And what's been different? Well, we adopted some plan out there, which apparently some people have a problem with. But ever since we enacted the Affordable Care Act, health care costs have actually started to level out because we have more people in the system. Which brings me to Virginia. And the minority leader and I, we sent you a letter. We told you all in the letter that last year Medicaid spent $6 billion providing low-income Virginians with insurance. 1.25 million people in the state. 708,000 of those people are children today. According to the Commonwealth Institute, if we would simply accept the money the federal government's offering to give us, money that we are sending to New Jersey, to Ohio, to California, money that we're paying that's going to all these other states, we could insure 300,000 people in this state. We could create 30,000 jobs, folks. And what really strikes me, Mr. Speaker, is that 194,000 of those people that could be covered are represented by people who continually vote against the expansion of Medicaid in this chamber. I don't get it. Because not only would it bring people better health, it would also bring a whole lot of jobs to a part of the state that really needs it. It would also bring a whole lot of jobs to my part of the state that really needs it. Because, again, we are all in this together. So, Mr. Speaker, I would just say that as we continue to debate and talk about how we're going to improve our economy and how we're going to make jobs and how we're going to improve the quality of life for our people, that we take a good long look in the mirror. We have solutions standing right in front of us. that will cost us not a lot of money, that could employ a lot of people and bring a lot of people a good quality of life. And I think we ought to consider that before we start pointing fingers at the federal government and blaming our president for everything wrong we see in our state. Thank you, Mr. Speaker.